Dr. Valentino to the OR, please. Dr. Valentino to the OR, please.
The halls are alive with the sound of moolah. Our prophet survived for another year. My heart goes ka-ching at the sound of moolah. There's just one thing to take care of here. She orders tests more than the rest, which we have to pay.
Her hospital admissions always have the longest stays.
She talks too much to her patients.
Can't see 50 in a day.
She doesn't make a profit for the health plan.
Hold on, I wouldn't be so quick. Many of her patients are quite sick.
If we fire her, they might go away. Insuring sickly people doesn't pay.
How do you solve a problem like Maria? The care she gives is far too comprehensive. How do you solve a problem like Maria? Compassionate, meticulous,
expensive.
How do you solve a problem like Maria? She costs too much to let her stick around. How do you make a doctor like Maria see the need to keep expenses down?
Many a time I know I've tried to tell her, just can't seem to make her understand. Our job at Mega Health is to grow shareholder wealth. We're not really here to lend a hand.
How do you solve a problem like Maria? How do you make a doctor a businessman?
Put me down, you pig!
Dr. Maria, your contract is up and we're not going to renew it. Mega Health can't make mega bucks if our docs don't see mega patients. Now remember, when you joined us, you promised that after leaving you wouldn't practice medicine within mega miles of here.
It's like waking up from a bad dream. When I went to medical school, I wanted to be a healer and make a difference in people's lives. But I graduated with so much debt, I had to put my ideals aside and work for the highest bidder. I almost forgot why I wanted to be a doctor in the first place. This time, I'll follow my heart and find a job as a real family doctor.
Google and Yahoo, search high and low, Monster and Craigslist, every site I know. Search every engine till the keyboard steams, looking for the practice where I can live my dreams, to be a small town MD, where the care that I give serves the community and helps people live. There's somewhere out there waiting for me that needs the family doctor. My heart longs to be.
Middlefield, Massachusetts. Small rural town seeks family physician. I used to dream of being a country doctor, and Massachusetts passed a state health reform law, so they have universal coverage. It will be like heaven. Today is my first day as a real family doctor. I wonder who my patients will be. Good morning, Rosa. All the patients on the schedule this morning are from the Von Trapp family.
Oh, the Von Trapps. His poor wife died a few years back. And even though they had insurance, there were so many bills that they went bankrupt. It's a crying shame.
Did you know that medical expenses are the most common cause of bankruptcy in the United States? And 3/4 of the people who go bankrupt from medical bills had health insurance when they got sick. Good morning. My name is Dr. Maria. How can I help you today?
I'm Lisa Von Trapp. I need birth control. As the oldest of 6 motherless kids, I sure don't want to be a mom anytime soon. These are my sisters, the Siamese quintuplets. Brianna has ADD, Caitlin gets migraines, Emily's got oppositional defiant disorder. Do not! Grace has anorexia, and Haley has asthma. They need some prescriptions refilled, and we all want to meet our new doctor.
And you must be Mr. Von Trapp. You look a bit tired. It must be hard to be a single working dad and keep up with all these girls.
It's not the girls, it's the bills. I know the kids need medical care, but with my share of insurance premiums, deductibles, and co-pays, sometimes I have to choose between that and putting food on the table. We're supposed to get universal coverage here in Massachusetts, but all we got is a mess of health plans so complicated it makes my head spin, and a law that makes us criminals if we don't buy insurance. The only policy I could afford costs $500 a month, with a $4,000 deductible and $50 copays for each non-generic prescription. The only thing it really ensures is that we're always broke.
Well, I guess that explains why you haven't been able to get the quintuplets separated.
It's like this. According to the state of Massachusetts, they're all one girl. And for a family of 3, I make too much for the state to help with premiums for a plan with a lower deductible. If I could ever get them separated, we'd be a family of 7 and get insurance without having to pay anything. What a crazy system.
Mass health in standard, essential and limited. Prenatal, common health, family assistance, Commonwealth choice and Commonwealth care. It makes you want to pull out all your hair. Deductibles, copays, and maximum limits. You never get out all the dough you put in it. Too many programs and too many strings. Is this the chaos that health reform brings? It's a mess and we can't fix it by tweaks here and there. Our health system's sinking just like the Titanic, and we're buying more deck chairs.